Moving from being a child to an adult brings with it challenges, excitement and some worries. When you're being cared for by health and care services, that can mean even more change. So what is that process, known as transition, like in Norfolk? What goes well and what could be improved? Healthwatch Norfolk was asked to find out by Norfolk Community Health and Care. Through a combination of surveys and interviews, we heard from nearly 60 people. The key things they said were support varied depending on which department or service you dealt with. Young people and their families felt that communication was lacking or non-existent in some cases, while professionals felt they were providing plenty of information. Parents said they wanted more support in the transition process so they could offer more help. This did need to be balanced with preserving the independence and confidentiality of young people where possible. There were calls for better planning around the process of transition, help with tackling complicated paperwork, ensuring there was just one point of contact for young people, and reduce the amount of time people have to repeat their experiences. Based on these key findings, Healthwatch Norfolk identified 5 recommendations to help improve the process of transition. These are: set up a process for gathering regular feedback from young people and families and carers, which will help give a better understanding of good practice and where things could be improved. Improve communication so that young people and their loved ones know what to expect from the transition process, and make sure professionals are working even more closely together to ensure services and care join up. Think about appointing a key worker who will be the main point of contact for the young person and their family through the transition process. Review the way transitions planned so that records are easily accessible and people don't have to keep repeating their story several times. Actively encourage parents and carers to be part of the transition process. In response, NCH&C has already announced an 11-point plan of improvements. These include developing a children's and young people's forum to hear the experiences of young people, the creation of a leaflet to explain the transition process, and extend the rollout of the Carer's Passport, which helps identify their role and would help as young people experience that transition. You can read more and download the full report here.